Welcome, everybody. Thank you all for joining us today. It's my pleasure to introduce Freedom Center, and Robin is going today has worked with us for a number of, I'm going to say over a year now, Robin. So I'm excited to share all of what we've been doing and the learnings and the future as well. So welcome to everyone. We're going to share more about EXI in a moment, but first off, it's important that I want you to meet Robin and meet all the amazing work that her and her team have been doing over the last number of years, and especially what they've been doing the last 12 months or so, and likewise for the next 12 months. So it's a very exciting time. So Robin, over to you. Tell us a little bit.
Thank you, Grace. And I also welcome all of you for joining us and taking your time today to be with us. My name is Robin Frey. I'm the fitness manager at the Freedom Aquatic and Fitness Center, which is located on the George Mason University campus of Science and Technology. My position here is I am the fitness manager, and I am also the exercises medicine program manager. We here at the Freedom Center back in 2019, or even prior to that, established exercises medicine as a medical fitness evidence-based condition management program. What we look for here is a clinical to community care continuum as a method of primary prevention and secondary management of chronic disease. This is simply based on the sound principle that physical activity, exercise are the best ways to address and prevent probably about 30 plus chronic disease, such as hypertension, obesity, diabetes, which we're all familiar with. Our program here at the Freedom Center is comprehensive and multidisciplinary. We educate, facilitate, and create long-term adherence, including self-efficacy through both condition-based exercise prescription and life behavior coaching with a board-certified behavior coach. We are also proudly one of the few fitness facilities partnered with the American College of Sports Medicine, which is a global initiative at this time to create physical activity as a vital health screening sign. We're IRB approved and in collaboration with George Mason for the collection of data and research and publication. And we've also received generous grants and donations to run our program. Our outreach is geared towards referral from primary healthcare providers, but our mission now is to expand into the community and outwards with options for guidance through both our one-on-one on-site comprehensive focus, as well our partnership with EXI to provide remote physical activity prescription monitoring and guidance. So I have a quote I'd like to share. And if anybody knows the answer to this, you can quickly respond in chat. No time to Google. We'll go over it and then I'll give you the answer at the end. If we could give every individual the right amount of nourishment and exercise, not too little and not too much, we would have found the safest way to health. Does anybody know the answer to that? I'll come back to it. So what we need to think about is this. Where have we gone wrong? Even today, we've not accomplished that yet. When we look at our statistics, steps have decreased approximately 70% since the Industrial Revolution. Screen time, both TV and social media, is about 7.5 hours a day. Less than 23% of adults ages 18 to 65 accomplish even the basic strength and cardiovascular training. And 75% of the aging population will have chronic disease or multiple conditions that will need the increase for functional dependence. Understanding that today as a society with said disease on the rise, mental health and unhealthy lifestyles, interprofessional collaboration must occur to include corporate wellness in an aggressive but reasonable, approachable, sustainable, and systematic effort. And with that, I'm going to go ahead and turn this back over to Grace, and we really highly encourage Q&A on our chat. So please join in.
Thank you, Robin.
You're welcome.
We're back. That's okay. I mean, the beauty of what you've been doing, Robin, if I just summarize important in particular here, because there's lots of people on the call and lots of people that will watch this who know some of the story. So the American College of Sports Medicine, really big organization that does phenomenal work and does a lot of work on producing guidelines and structure around the exercise medicine program. So that's a really important, history lesson for those that may or may not know that. There's clinicians like yourself professionals like yourself across the world, not just the Americas, but across the world, who are delivering the exercise medicine program in plenty of settings. Some with a team like your own, some in centres, not many. You guys do it, I think, in a phenomenal way. And then some that are also doing it with one-on-one structures. We talked recently with Dr. Liz Joy, who's one of the founders of the exercise medicine program over 15 years ago. And we talked about the benefits and the values of putting a framework around this. Because to your point, there is millions of people who don't know what to do and need the support, need the framework, need the professional, support in order to get people to be active safely. So you've done a phenomenal job, and the Freedom Center, for anyone who hasn't visited there yet, if you're in Virginia, it's absolutely worth a visit. It's a fantastic center and well connected to the George Mason University. So lots of research, and you mentioned your IRB as well. So it's a very evidence-based approach, very safe approach with a great team. And I know, thankfully, I've met a lot of your team, phenomenal people that are delivering amazing results. And one of the things that we did last year when we met at the George Mason University at the Freedom Center is we met a lot of your users, and I found that powerful because, like anything, real people seeing real results is where it's what's important. And the users that we met, some of their stories were fantastic, and likewise, they were a breath of fresh air in many ways of people that thought they'd never be able to achieve what they achieved. And with the support of the EIM and the Freedom Center team, they were absolutely able to change their lives around. So just a kudos and a well done for that. I think that's a really important factor. That is, lots of people on the line may or may not know, and definitely so highly encourage people to interact with that. The numbers you shared, Robin, are a bit stark, aren't they? Like one that I just took note of there was 7.5 hours a day on screen time. And I'm no different, right? I will spend the vast majority of today sitting down, looking at a screen as part of my job, as well as will many. So we have a bigger challenge than we ever had before, and we have more people working remotely, and we have more people working from across the nation. I will go out to a coffee shop later on today potentially, and I will do my emails from there. So we're not only working remotely, we're working in different locations. And we may or may not have active lives like we used to. So the stark numbers there. And the numbers of people that should have access to the program and should participate in the program continue to increase because the chronic conditions you listed also continue to increase in terms of prevalence. So the opportunity is huge. One of the things that, and I'm going to get back to in a second as well, as like who this is for and how do we get people to get onto the program in order to benefit and see the results that they want to see. One of the things that we've been doing is working with the American College of Sports Medicine. For those, everyone that's listening, for those that don't know, Exercise Intelligence EXI is the digital solution for the exercises medicine program. So we pull in all the science, and the idea is that we personalize the program in order to complement what the exercise physiologist team and the likes of Robin's team are doing in order to reach more people at home. Those that may not be able to access the Freedom Center, or those that don't have the means to do so as well. So that enables people to get a program at home, to get support from the Freedom Center team, but at the same time then potentially leverage FSA, HSA, fitness reimbursements and so on. So there's a beauty here of the employee who has access to funding reimbursement opportunities can leverage the program with their payment schemes, payment models, may always be able to pay for it as well, because payment is obviously a problem that we've faced, I think, across many population groups as well. So huge opportunity to connect the dots together, and hence the work that we've been doing with Robin and the Freedom Center team has been to expand out how do we get to more people, support more people to be more active at home in their community, and ultimately to see the health improvements that people want to see. Robin, quickly, before we go on to employees and employers and the opportunity there, which is absolutely huge, healthcare is where this has really started and where it's been focused on for the vast majority of time. And every exercise physiologist that I work with, has challenges in relation to getting referrals and enough people through and enough clinicians to understand the program, the structure, why it's important to refer. And likewise, there's been, for those that are referred, potentially some lack of data flowing back to that clinician for them to go, oh, I see the results, I understand them for my patients, hence I'm going to send more patients. So this is where, hopefully technology kind of can help complement as well. But give me some of your thoughts just around the healthcare model of referral into the program, and likewise the healthcare that data flow.
Yes. So again, being more of a preliminary fitness facility here doing this program, not a clinical environment or clinically supervised exercise prescription, what we initially found out is that we had to build the integrity of our programming and relate that message to healthcare providers. Oftentimes you think of a fitness facility as a gym and offering a fitness program to people who may be recommended because they're obese or, again, chronic disease. For us, it's educating that this is not a fitness program. This is a functional dependence and quality of life, focusing on self-efficacy programs. So it's much more layered. And again, we don't look at fitness as the goal. The measurable outcomes are the biometrics that we know with exercise and behavior modifications that we can improve within our program. So that takes time. Is it 100% acceptable at this time? No, because again, with American College of Sports Medicine, the global mission is to create physical activity as a vital sign. So far, we don't see that in the electronic health records in every organization, within every organization. So that's where I see some of the times that we may come across, the credentials, the understanding of what we do. It's still fairly new, especially coming from, again, a fitness industry. So what we try to do and what we find, Grace, even with people who do not present for this program, I would say at least 50% and above are presenting with some type of predisposed or diagnosed chronic disease. It's just our society. It's just how things are right now, from youth to aged people. So we have to look at that in the same context. We can't just provide exercise and a socialized environment without making sure we understand how we actually need to present and kind of divide what needs to be done for people with condition management. Not everybody needs just cardio, and not everybody needs just strength. And we look at it from going from sedentary to active and including daily activities. So we create that whole narrative of a healthy lifestyle and active lifestyle. Is not just 30 minutes or 1 hour a day.
And it's really important to land those messages, isn't it? I think, as you said, lots of people may not understand what is health enhancing. So that those statistics are fantastic. Robin, when we started working together, digital EIM was a new concept, right? We were new as well. And part of what you guys and your team did was take us to task, which was fantastic, and really to test it and challenge it and go, well, what about this person in this scenario with this persona and these issues and so on. So it's been absolutely fantastic to work with you and the team. As early adopters, it takes a lot of, confidence as well in your program to go, well, how do we do it better? And it takes a great leadership team to look at what else can we do? We have so many people who we want to be able to help. So how do we do it? Tell me talk to us a bit more around leveraging digital, leveraging an application, the likes of EXI, to complement what you guys are doing in Centre. Give us some of that context and the reason why you and your team were excited and are still excited, and we look forward to doing more.
Well, for us, we were very particular in our search for some software technology to support our one-on-one program. A lot of it came from actually COVID, because when we did launch this program with a grant from the university, everything shut down. So we literally had to do virtual. So at that time, we didn't have access to EXI or the capability to have, a more monitored approach. So that's why we look to your company. Personally, I feel because it's medically based, condition based, it fits with what we do perfectly. And bringing awareness to people just by seeing and understanding from the very beginning, being aware of steps, being aware of activity, being aware of some biometrics that EXI provides, it really supports what we do. We have people that, for the most part, are one-on-one in-house, but we also do have people that often are outside of our environment, and we're able to capture the information. Again, it's twofold. We want to be able to monitor what they're doing, support them. EXI provides excellent guidance regarding cardio and strength prescription as well, so they can do that independently. So it's just a perfect match of the technology part of what the industry is, pretty much saying that needs to be involved, and the one-on-one person is just a perfect blend.
And that's really it, isn't it? It's the blend and complement, because people require different solutions and different, support. So we got to be working together. So thank you. And it has been absolutely fantastic working with your team. I appreciate you've shared a lot there in the last few moments. So please, for anyone listening, drop in your questions into the chat and we'll pick up on the questions as well, because we want to make sure this is, valuable to everyone who's attending. Because the reality is, when we're talking to these programs, Robin, we've talked about talking to clinicians, and I think clinicians understand exercise medicine as a concept. They may not know the framework and the program in detail, and hence why we want to make sure we're educating and sharing more of the real stories, the real patient outcomes, and the impact that it's having. We also want to share more around what is a medical software for exercise. So this is new, right? So the beauty of what we're doing is also new. And likewise, we've been trying to make sure we produce lots of evidence and around efficacy and effectiveness and safety, so we can reassure professionals like yourself, clinicians, as well as employers, as well as employees, and ultimately people at large. We've touched on the payment mechanisms, and if you're an employee, there usually is good benefits available for people to get access to fitness. And as you said, this is not a fitness program, but in theory falls under a fitness reimbursement. So there's definitely a conversation and support to be had there if you're in HR or if you're in benefits and you're not sure if this ties in. It absolutely does. It absolutely does. We are here to ensure that with a medical solution, people can get active safely to treat the chronic condition that they have, in order to do so in a way that's complementary to their lifestyle and to their conditions and medications and so on. So lots of opportunity there. And I know right now, Robin, you're starting to talk to more and more employers, I think, and organizations in the Virginia region as well. So tell us more of who you're looking to talk to and why you're looking to talk to them, and what questions you're able to answer up front, or what are you expecting?
Well, I think, and Grace, I want to refer back to you as well on this, is that you have some excellent facts on your information from EXI of results from people who have used EXI, and looking in terms of corporate wellness. If you own a business, or if you are involved in employee relationships and interaction and wellness, we know that how this affects the company itself, let alone the individual employee, is important for that balance. For example, absenteeism, less productivity. If you hurt or are not feeling well, your productivity is not going to be there. We cannot cure the world, but we can make sure that corporations are supporting the need for the work-life balance, and that they are able to offer their employees this type of an interactive digital device that will help them as well. And Grace, if you want to provide some of that information, it's really astounding improvements. Yes.
Yeah, we're super excited about these results, and likewise, as I said, to share them. So just for those on the chat, what we've proven recently is we're targeting and designing people who are the least active in our populations and ultimately have risk or are diagnosed with chronic conditions. So this population that we're trying to support might have tried to be active before and haven't succeeded in seeing their health improvements for different reasons. So we're seeing in the most least active population, which is the most important population to get moving, over 600% increase in physical activity at 12 months. It's absolutely powerful. And I think it just shows that if we give people a personalized program that is safe and that starts where they are at today, that could just be, I'm not able to move more than 5 minutes a day for whatever reason. or they're nervous because they have a diagnosis that they don't fully understand, or a medication and side effects, it absolutely proves that we can give people a personalized program. They will try it, they will increase their confidence to achieve it, and they'll achieve their activities over the week, and they will incrementally be able to increase that activity week on week on week on week on week. And when they do that, and to your point, Robin, the significant results we've seen we're so proud of them. The weight loss is significant, the waist circumference is significant, and the hypertension results and reductions are also significant. So hugely valuable there. And there are there's probably 2 or 3 main conditions that employers are seeing that are very prevalent across their entire population. Hypertension being one, for sure. We know that the population at large, in the US, for example, I think it's 44% is eligible for the GLP-1 anti-obesity medications right now. So phenomenal numbers there. And your point exactly, if somebody has a chronic condition, the chances of them needing more medical care and needing more days off is much higher. Naturally, they have more appointments to be seen, and also, unfortunately, might drive presenteeism reduction as well. So there's numerous cost factors in there, and an employer is trying to balance and manage. And as we all know, physical activity programs previously that employers might have funded might not have proven the ROI, because partly a lot of the programs, and I would have been on the HR side of Apple for many years, a lot of the programs we'd implemented usually target the fit getting fitter. So it's fantastic people who are engaged in their health, who are already kind of active, and it complements it nicely. So on-site fitness centers, the likes of yoga in the mornings and so on, and actually gym passes and so on, which is fantastic, and they do have an absolute value. But in terms of the healthcare cost, there's very little return there, and also there's very little data flowing back into that ROI. Whereas a program like yours, we're not only able to provide something to the population who have the most complex needs for chronic conditions, but also to be able to tie in the dots here of the changing of behaviors, the changing of health improvements, and then likewise the change of the cost impact. So being able to tie all that together, I think, is really important. And likewise, as you said, as we do this in conjunction with a partner like yourselves, it means that people who need face-to-face can get face-to-face. People who don't need face-to-face often can get face-to-face as often as they like. Or those that are happy enough to go, I just need a program I can do at home, and then I just need the encouragement from a team every so often is what I need as well. So it caters for those different bandwidths, which is quite important. So yeah, you're right, Robin, and thank you for bringing it up. We're delighted with the results that we're seeing. And our head of research, Dr. Lou Atkinson, is still analysing more data around cardiac rehab, as well as bariatric surgery, as well as pre-diabetes, as well as type 2 diabetes. So there's lots of more great data to come, because the ultimate overarching goal here is if people are more active, they change their health, they have health improvements, they change their behavior sustainably, and likewise then it's a win-win-win scenario for all involved, especially for the person who might be paying for the healthcare costs, especially if it's an employer, for example, or an insurer, depending on the model. So we're delighted. I think the program has been super. One thing we want to call out as well for the population on here today, because I know this is a relatively short webinar that we're focusing on, is around how do people come to you right now? If someone's on the line or someone's watching this afterwards and they're saying, this is fantastic, I want to be more active for health, I've got A, B, and C condition, I think I'm eligible for the program. Where can they go to find more information? And also where can they go to even sign up? Let's base upon action.
Okay, basically we can have you referred. I don't know if Sarah has the information. One of our administrative lead for the exercises medicine team, who is Carla Balk. If Sarah can please put her email address up on the screen. You can contact her directly. That's the starting point, whether it's, again, remotely with EXI or one-on-one with us or a blend. This is the best way. And this also we can guide you to more information regarding the exercises medicine through American College of Sports Medicine, what we do, any more information that we can provide for those who are interested, and in particular, looking at this for corporate wellness and how to engage and have this as part of what the services that is offered. That would be the best option. And also, if you go onto our website, the Freedom Aquatic and Fitness Center, George Mason University, we have a link, and you can get the very basic format of our program, the program that we developed. It'll give you the information on how exactly the program is conducted and what to expect as well. So mainly those two areas.
And the additional benefit here is with our partnership, Robin, we're able to provide some complementary cases here for people that may not be able to leverage an IRS compliance with FSA or the fitness reimbursement and so on. So do you want to share a little bit there so anyone can also pass this along to their teams?
Sure. When we again first came and made our agreement and contract with the EXI, they were generous and gave us free license to distribute. So we have approximately 80 free licenses for EXI that we can distribute as a first come, first served basis. So if you're interested in receiving that, if you have an Apple Watch, I believe Fitbit is integrated, correct, Grace?
Absolutely, yes.
That's all you need, and contact the email that's on the chat, and we will get you set up and get your name and information, and it's just that simple. And then we'll be able to distribute these. And I really, sometimes we look at different groups of people that may want to do this. If you're a small employer, if you're a large corporate employer, if you create that role of socialization within your organization, say you come to us and say, we have 10 people that would like to make a team to start, towards a healthy lifestyle. Again, first come, first served. We can give you 10 of the free license, and you can start your own little cohort within your organization. So there's many ways to be creative with this, but please reach out to us because we want you to experience just how wonderful the medically driven app is, and the information that we provide as well that can make you hopefully successful with anyone's personal goals. One thing I want to, before we end, the quote. I don't see anything in the chat. No one even Googled for the answer?
I'm sure we have one or two.
Okay, so that quote was written by Hippocrates, who lived 470 to 410 BC. And once again, we still haven't gotten it right. But we will not stop trying, correct, Grace?
Oh, absolutely. And I think I say this in every single webinar. If we all work together, we will absolutely change the status quo. There is millions of people who need more support. And ultimately, what I want to do is to help connect the dots between people who need support, who wanted to help get some health improvements, and the professionals and programs like yourselves and what we're offering in order to enable that. So we will not give up. We absolutely will not give up. We're in this for the long haul. It's definitely a vocation for anyone in healthcare. That is for sure. So Robin, thank you so much. It's been an absolute pleasure. We don't have any questions in the chat, so that's perfect. Everyone has our follow-up. I think hopefully Carla is getting the follow-ups on her side. It is a pleasure every time we work with a team like yours, who is not only thinking about how better we can do it today for our users, but also how do we get to more people and support more people and do it better in the future. So it's fantastic to see early adopters like yourselves, but also making sure things are credible, safe, personalized medical. It's so important. And we're delighted. And we're going back to your point here is we're delighted to be able to offer, additional licenses for people who are looking to achieve what you're driving and what you're creating. So I look forward to working with more organizations to tie more organizations, more people to the EIM program, regardless of where they're situated, regardless of location. So it's delighted. So Robin, thank you so much. An absolute pleasure again. I look forward to meeting you again the next few weeks, and likewise bringing more stories to the population at large. So thank you again.
Thank you, Grace. My pleasure as well. And thank you, all of you who took time to attend today. And please reach out if you have questions. Thank you.